Let's talk about expectations for me as a provider and also for my clinic. I tend to be pretty direct about things because that's how I would want it. So if we ever have to talk about something heavy, know that I don't really beat around the bush. On the flip side, if I ever reassure you about something, I'm not sugarcoating it either. So I'm always going to be very transparent with you. I also commit to treating you like family. That's just how I operate. So you never need to ask me the question about how would I treat, this situation if it was my mom or my sister. That's how I approach every patient. And then lastly, I respect your decision to do anything that you want to with your eyes. These are your eyes, your body. My job is to help you navigate what's going on and help you make the best decision that you can. Let's talk about expectations for my clinic. Half of what I do is I'm a glaucoma specialist. And there's very few of us out there. I wish there were more, but currently there's only 4 of us who do some of the surgeries I do in this half of the state. And the other half of my clinic is I'm a comprehensive ophthalmologist. So I do lots of cataract surgery, both routine and advanced, and healthy eye exams, pretty much anything that would come through the door. I do not do contact lens evaluations or a special type of glasses called Prism. So if you're ever expecting either of those, know that I defer them to my colleagues because it stretches me too thin otherwise. Because of the glaucoma side of my clinic, occasionally I can have more variable and sometimes longer wait times if I get caught on a day where I have to have several heavy conversations back to back. For example, meeting a patient for the first time and having to talk about a high-risk procedure on their only eye to try to prevent blindness from glaucoma. If you get caught in a situation where you've had a few long visits and the wait times are becoming a burden to you, please let me know, because I have folks in 2 categories. There are many patients who do not have to have my level of expertise as a specialist. And in that situation, I would get you with a colleague where they would monitor you, and then I'm always there in the margins if something gets complicated. Lastly, this is a team effort. I could not do what I do without the support of those behind me. So you'll notice I lean heavily on my scribe, for example, who will take care of all eye drop refills. And then, for example, my surgery scheduler, who manages all non-medical questions and logistics around surgery. So questions about where the surgery is and when, and navigating certain personal circumstances that may relate to the timing of the surgery. All of that will be through my surgery scheduler. And the purpose of that, as well as these videos that you may see from time to time, is to maximize our face-to-face time together so that it can be more constructive and meaningful and more pertinent to your specific needs. And I do appreciate your time and your patience, and it is an honor and a privilege to care for you that I don't take lightly.